All right. This meeting's coming to order. Good morning and welcome. This is our May SEB Board Meeting. Meetings this year are going to continue to be hybrid. HCA staff will be on site. Board members and other attendees have the option of attending on site or via Zoom. For our members of the public attending via Zoom, our opening slide has information on how attendees can turn on closed captioning. Also, public meeting attendees will only be available to activate their audio or video during two things, just before board votes on a resolution and the general public comment at the end. At that time, participants going to need to raise their virtual hand, and after being recognized by HCA staff, they'll see the ability to turn on their audio video options. We're going to do roll call for board members. You got a pen, Barb?
Sure.
I always need a pen. I forgot my pen again. My fault. No, it's okay. Allison's got a pen. You got a pen. We know that. Okay. Boom. No lip gloss. No lip gloss, please. Donna.
Good morning.
Good morning. Myra.
Good morning.
Allison.
Good morning.
Clara.
Good morning.
Carrie.
Good morning.
Pamela. No Pamela? Okay. You're not the last one. Omid.
Sorry. Good morning.
Good morning. All good. Terry.
Good morning.
And we have Katie Hatfield and
Hello.
Genta. Is that correct? Genta? Genta. Okay. Welcome from the AGOs. And I'm Lou McDermott here with the Healthcare Authority. For board members attending both in person and virtually, really helpful to hold your questions until the presentations are done or when the presenter is pausing and asking for questions. And if you're attending virtually, we'll be watching you to raise your Zoom hand to indicate you have a question. If you're in the room, just do what you normally do. People still raise their hands. We do have one resolution scheduled for action today, and the public is going to have an opportunity to provide comments on the resolution during the normal procedure before the board votes. We normally, if everyone remembers the cadence, we normally show it, and then the next board meeting, we vote on it. But this one, I'm being told there's a sense of urgency, so we're going to do it today. And the public is also going to be able to provide general comments at the end of the meeting during the public comment. As a reminder, if the public has questions during staff presentations, the presenter's contact information is going to be included at the end of the presentation. The public's welcome to email, and we'll try and get you some responses. Dave, why don't you go over today?
Good morning, Chair McDermott, members of the board. Today, we will talk about the fact that the legislature left town on time and had a bunch of bills and the budget bill among them that passed, and we'll have the review of the status of bills and the conference budget that is currently being reviewed by the governor's office from Tanya. Then we're going to talk a little bit about long-term disability because one of the parts of the budget tees up the ability to make an adjustment in the long-term disability benefit. So we're going to walk through the long-term disability benefit and tee up a resolution there for action next month. After a brief break, we will bring forward a resolution for immediate action related to the UMP benefit design. We'll talk about the urgency and the unusual timing of asking you to take action on that particular resolution when we're bringing it to you. I think it should be fairly non-controversial and something that people appreciate that we'll be able to hopefully move and begin immediately implementing on. But we'll talk more about the context of that when we get to that part of the morning. Then, as we continue talking about things that happened in the budget, there's a piece of the budget that funds collective bargaining agreements, and there's another benefit coming in the SEB program that the agency will administer that Kelsey will go over that relates to the flexible spending accounts. Then we'll have our monthly update on benefits 24/7, have some public comment, and then go into an executive session where we begin talking about the status of the rate negotiation process for the 2026 rates. That is our day. There are a couple of other reminders. First of all, go down the hall if you need the bathrooms. The elevators look on your left. If we have an emergency, we walk purposefully, not fast or panicked, across the street into the visitor parking lot. I do have one other update that doesn't really fit nicely anywhere. We had a member who brought to our attention, both in correspondence and then also a public comment at the PEB board meeting, some questions about the spousal surcharge and how it applies or doesn't apply in scenarios where somebody has the ability for eligibility in both programs. So the spousal surcharge is that $50 monthly surcharge that's designed by the legislature and many employers in the country to disincentivize someone from waiving other comparable medical insurance coverage to then shift cost to a different employer. So think of it this way as like well, we'll use King County because I'm looking at Cary because King County is not part of PEB. If somebody has eligibility as an employee in King County benefits and they have a spouse that works for the state, they waive benefits in King County, and then the state becomes the primary payer for all of those spouse dependence claims. That's what this surcharge is generally about within the employer setting. But it's not just public sector, it's private sector, of course, as well. So this member is someone who is a dependent currently of a UW faculty member and then also moonlights as a substitute in school districts. And so they got SEB eligibility. We're all aware that this happens kind of near the end of the year for a variety of substitutes. And so they were noticing that if they waived SEB eligibility to stay on their dependent, as a dependent on their on the PEB account, that there would be a $50 charge on the PEB account for that person having waived comparable coverage over in the SEB program. So we were all looking at this. And we realized that as things have changed in recent years, especially when the dual enrollment prohibition was passed by the legislature, and many of you will remember the dozens of policy resolutions brought to both this board and your sister board about the auto enrollment and disenrollment processes and the interactions of dual enrollment, there was a piece that no one ever really brought up, nobody ever really thought about, that these programs are getting to be more similar today, and that cost shift from one employer to the other really isn't as big of a deal in this scenario, because at the end of the day, the vast majority of the funding is coming from the state. And although the state is not the employer per se, in these scenarios, the funding mechanism is primarily the same. So that cost shift and the fundamental basis for the spousal surcharge doesn't really make sense in this scenario. So we have begun implementing an adjustment to how surcharge policies are implemented, and we're going to adjust things so that scenario, the spousal surcharge will no longer apply. So when a spouse is waiving SEB eligibility to become a dependent on PEB, or when someone is waiving PEB to become a dependent as a spouse on SEB, the spousal surcharge will no longer apply. So we're working on necessary rule and administrative policy revisions, adjusting questions in the surcharge questionnaire that people fill out. And because these surcharges are on a pre-tax basis, that gives us a little bit of flexibility. So we're going to actually do this implementation retro to January 1st, which means we're going to issue some refunds to some accounts for people who have been paying the spousal surcharge in this scenario back to January 1st. We're going to begin communicating this to benefits administrators in the next couple of days. It'll be implemented via the May payroll files that are coming. We're working on some letters that will go from the healthcare authority to the members who were impacted, letting them know of this change and that they should expect to see a refund related to surcharges that they paid this calendar year. So just wanted to apprise you of this. It's one of these fast things that there's not a lot of times that we can all move fast, but this member brought something to our attention. We looked at kind of the underpinnings of it and go, oh, there's a way to provide some relief here when you go back to the fundamental nature of what the spousal surcharge is designed to do. And it doesn't really make sense in this environment anymore, especially when there are a lot of policies that automatically enroll and disenroll people in between these two programs. So I just wanted to share that with you. There was a piece of correspondence in your packet that directly related to this. I just wanted to give you an update that this is something that we are working on and implementing, and just wanted to share this with the board. Donna. So we have pulled the data, and it's somewhere, I don't know the exact amount that are getting refunds. The way that I was reminding myself of the data today. It's between a couple of dozen to a couple of hundred. So I think the high water mark is around 250 accounts, and the low water mark is somewhere around 75. So it's a reasonable amount. And so some people might get $50 back depending on when they started paying the surcharge, or it could be up to $200 for this calendar year because it's 50 a month. So really a way to provide a little bit of relief here. Laura, you look like you might have a question.
No, I was just trying to remember in question 4 or 5 how it's worded, because it said something about, is this other coverage for SEB coverage? Does it not reference PEB there?
So on PEB, it references SEB, and on SEB, it references PEB.
Oh.
And we noticed that there's some confusion. And so that question specifically, you're at question 4, is going to be reworded to avoid ambiguity on this scenario anymore. So that's actually also in works as Q4 is changing.
Other questions or comments for Dave? All right, Dave, thank you. First up, we're going to approve April 3rd meeting minutes. We're going to be voting on the meeting minutes from our April board meeting. There's behind tab number 3. Any comments from the board on those minutes? Seeing none, do I have a motion to approve minutes as written?
Myra Johnson, motion to approve minutes is written.
Is there a second? All in favor say aye.
Aye.
Aye. Any opposed? Hearing none, the April 3rd, 2025 minutes are approved as written. Thank you. Next up, Kate Walker, Ledge Update, Policy Rules and Compliance Section Manager from ERB, and Tanya Duell, our ERB Finance Manager, is going to give us a little presentation on how session went. Materials are behind tab number 4. How did session go, Kate?
You know, gotta admit, I was. What we want to? No, that was a busy one, a long session, and
Okay, Tanya, apparently they haven't had a pre-meeting.
Tanya gets a different sort of side of the story. I get to talk about the policy side of the story of the session, which was, by all means, I think fairly. When you don't, as my old man used to say, no mun, no fun. So with the budget being the way it was, I think there was a lot less ability to do a lot of things policy-wise, because a lot of policy takes a lot of money. And given the budget deficit that we're facing, there just wasn't quite as much ability to do as many things policy-wise as I'm sure that a lot of the legislature would have liked to have done. So, but there was still a lot of movement that did happen in different policy areas. So we'll get into that here in just a second. But first, next slide, please. I want to make sure, I like this slide to remind me to always make sure I thank all of the analysts in our division and our support divisions that we work with, all of our fiscal team, Tanya's team, and everyone. You can see here the culmination of 213 bill analyses being performed is the work of thousands of hours of our staff working to review bills, sometimes review them, multiple iterations of them, whether that bill only had a single page or maybe had 40 some odd pages. Sorry, Mr. Ramsdale, for probably having the most complicated bills to review this year. A lot of work for the team, so I want to make sure I give them all a big shout out for the tremendous amount of work they put forward in getting everything done on time. Our process for bill review is a really quick turnaround. We get a bill introduced in a morning. It will get assigned to an analyst by that afternoon. They've got sometimes just 3 days, sometimes just 1 day to do a complete analysis on that piece of legislation, regardless of how big it is. Again, if it's 1 page or 50 pages, they've got 1 to 3 days to get that bill analysis completed, which is an entire form that will take up probably about 3 or 4 pages, sometimes longer, depending on the length of the analysis. Have it reviewed by multiple individuals, including myself and their managers, and then we put it into our system for finalization. So it's a lot of work that goes into this. And so our team has done a phenomenal job again this year in getting things done timely and professionally, and calling out things that need to be called out for us to pay attention to, and overall doing just a fantastic job this year. Next slide, please. Here's our waterfall of where things went. This is just tracking those high priority bills that the ERB is the lead division on, as opposed to other divisions in the agency. So you can see here quite a cascade of where bills actually fell off their ability to move forward in the session, with ultimately 5 bills that we were tracking that were high priority, making it all the way through to the governor's desk. Now, those are just the ones that we were tracking that had a high priority, that we were the lead SAS on. But that doesn't mean there's not other bills that we weren't tracking that were a lower priority because they didn't meet a certain financial threshold. They didn't have a significant cost implication, or they didn't have a rule change implication for us, which is what we tend to categorize as higher priority bills. But you can see here quite a few bills kept making it their way through the process. And as a reminder, this was the long session. So the end of this full legislative session will be next year when the short session convenes. And all the bills that were introduced during this year's session will be introduced by rule next session if they weren't, they didn't pass and make it to the governor's desk this year. So all the legislation that we were tracking this year will be reintroduced by rule next year, and they'll have another chance to mark its way through the process next year. And so we'll be tracking those again next year. Then after next session, everything is wiped, the slate is wiped clean, and every bill has to be reintroduced again when the next legislative session convenes. Next slide, please. Our two pieces of agency request legislation that we've talked about before did pass. Both Senate Bill 5083, ensuring access to primary care, behavioral health, and affordable hospital services, also known as our affordability bill, that did pass and is awaiting governor's signature, as well as did the legislation that we introduced to extend the same benefits offering authority to the PEB board that this board currently has by means of the different optional benefits that are available. Again, it didn't require the boards to introduce any benefits. It just gave them the same authority that this board has had for a few years to offer things like pet insurance, car insurance, expanded property and casualty insurance, fixed income or fixed payment, like cancer insurance or other types of things like that, travel insurance, legal services, that sort of thing. So the boards now have alignment in their authority and what they can. Well, as soon as it's signed into law by the governor, then the boards will have the same benefits offering authority, which will grant you greater leveraging in the future should either the boards want to move forward with an optional benefit in procuring something different like pet insurance, which we hear a lot about from members, especially from SEB members, and we hear a lot about it from Dave about the interest of having pet insurance at one point. So at some point, having that the authority extended to both boards would be very, we can leverage that for introducing optional benefits for both boards.
I'm just going to add a couple of pieces of context. I own no pets anymore, so I'm personally not vested in pet insurance anymore. But I do hear a lot of members talk about pet insurance, so that's why I talk about it. To me, that Senate Bill 5478 was another important step in being able to talk about additional benefits. It always made sense to me that if the agency was going to go through the effort of putting together a benefit to bring to one board, that it would make sense to leverage both populations and do it for both boards. So this was a prerequisite in my mind to be having a conversation about any of those future benefits. So not that there is something that is eminent on our to-do list. There's plenty of other things that we need to do that are our core mission, especially with our state budget, the way it is focusing on our core mission. But I did want to highlight that this kind of sets the stage for those conversations. And just a reminder that even if we were to start those conversations today, it's probably a 2-year journey for something to actually be offered. So it's not something, again, that is eminent. On Senate Bill 5083, just a little bit about that bill. It does a variety of pieces, but at its core, one of the things it does is it caps payment rates for various provider and hospital systems in the state, while also taking some of that money that would be saved from the outlying projections of expenses within both programs and reinvesting that in increased rates for behavioral health. So there's some savings that is taken by the state and put into the state operating budget to help with the budget deficit. And there's a component of it that's reinvested in behavioral health rates. So that at its core is what it does. The agency has a lot of rulemaking and contracts to update related to this, and the carrier community for the PEB and SEB programs will have a lot of provider contracting negotiations that need to happen to implement this bill. But at its core, that's what it does. I think I described at a prior board meeting, there's only so many ways to influence the PEB and SEB budget. One is how much we pay for things. This bill is an example of that. The other is the cost share differences or the benefits levels between the cost share payments between the employer and the employee, or the benefit levels themselves. So this is one of those 3 stools of the likely ways that you can influence the budget for these programs, and it is something that passed the legislature. So it had a lot of different journeys, a lot of different iterations. Happy to bring information to the board about that as we work on implementing it, but it is a big step forward in some cost containment aspects for these programs.
And the last note on 5478, just in case you're getting excited about the possibility of pet insurance or whatever, it does require that any of those optional benefits that are offered are entirely employee paid. So while there is a cost associated with the procurement effort and probably having a contract manager there to manage whatever optional benefit would be there, the entirety of that benefit by statute would be employee paid, no employer contribution to that. Yes. Potentially, we'd have to take a look at them and see if they qualify under those. I mean, obviously, pet insurance probably not. Travel insurance, we'd have to go through the list. The only one I'm thinking of that potentially would be some of the fixed payment reimbursements, like cancer insurance may fall under it. But if we get to that point, of course, before we do a permit, we would have a lot of information on that, on the implications for it. All right, moving forward.
Follow-up question.
Yeah.
since we're going to go down the pet insurance, is it the legislature that would say to healthcare authority, you may procure for pet insurance, or does that come, do they have to direct you to do it, or could it be
No, so
you
the,
have administrative
the,
authority to do?
the authority, the administrative authority exists now in statute.
Okay,
And so the board has the authority, the SEB board has authority currently in statute under 4105, 745, has a list of 10 different types of.
section,
Yeah,
right.
so it has 10 different benefit types.
Fun.
So it exists there in statute currently says that the SEB board has the authority to offer any of these benefits subject to it being employee paid
Got it.
and subject to available funds.
Got it.
And so it doesn't direct them to. Now the legislature could at some point change some of the requirements of the board to offer that exists in the statute that says this is what the SEB board shall procure for the SEB population, like medical, dental, vision, which is in the thou shalt procure aspect. This is thou may procure subject to funding and these requirements. So that
And then
catches that.
Allison, broadening your question a little bit, sometimes the legislature will direct a procurement. Other times the agency can initiate the procurement, but sometimes those procurements we determine need additional resources and we may tee it up as a decision package. And if that happens and then it's not funded, that's an implicit sort of no. So it depends.
Got it.
And the lawyer answered it.
Dave.
All the sub members from a variety of school districts, roughly 30.
I mean, my dogs are getting up there and it's about time. They're probably gonna start choking on something with their little snub faces. So, all right, moving on. Oh, I have two little pugs. They hadn't seen them. They're always on my Zoom with me, and they're entertaining, as they were bred for. So moving on to the past legislation, try and move through these fairly quickly and feel free to ask for a little bit more information on any of them if you'd like. Talked about most of these with you all before at previous meetings. So these have all passed, and if they've been denoted by an asterisk, that means they've already been signed by the governor. No reason to believe that any of these won't be signed by the governor, but until they're actually signed, there's always a chance that it may not happen. So House Bill 1114, this is including Washington State in the Multi-State Respiratory Care Compact, similar to other compacts allowing for greater accessibility to respiratory therapists, especially around the borders of our state. House Bill 1186, expanding the ability for hospitals and healthcare entities to prescribe longer dosages of medicines, especially out of the emergency rooms or other facilities where they're allowed to prescribe out of. House Bill 1432, improving access to appropriate mental health and substance use disorder services, just creating some administrative simplification of the requirements for providing mental health and substance use disorder. 1669, coverage for prosthetic limbs and orthotic braces. This actually did not include coverage that would, that's not requiring for the PEB and SEB programs at this point, but it was for all other commercial plans, expanding some of the requirements and recurrence of getting custom orthotics or prosthetics. House Bill 1971, increasing access to hormone therapy, and this expands the ability for prescribers to prescribe up to a year's worth of hormone therapy, which does include hormone replacement therapy, but also does include other hormone therapies as well, expanding the dosing from 3 months up to a full year on a single prescription. Moving on. Senate Bill 5351, ensuring patient choice and access care to prohibit unfair and deceptive dental insurance practices. This aligns dental insurances with some of the requirements that exist for medical insurance plans when it comes to provider notices. And as you're probably aware, there's the notices that medical providers have that when they're negotiating and get down to 30 days or less with the insurance company, they have to provide notice. This places similar type requirements on the dental industry. So if there's negotiations happening between a dental carrier and provider, and it gets down to that 30-day mark, they would also have that same requirement to provide notice. We'll have to see how that plays with Senate Bill 5579, just skipping ahead a little bit, because that is legislation that was meant to address some of those concerns that have been popping up with that requirement for medical plans, where the negotiations get to that 30-day mark and all of a sudden that letter goes out from either the health insurer or from the providers, and all of our members get those letters, and it causes quite a stir. Our members, 5579 places some additional requirements on both the insurers and the providers as to when they can actually send those notices out. placing some legal requirements that says you have to have reached kind of X amount of effort in the negotiations before that letter can be sent out. So that it's trying to take, I think, a bit of the leveraging of public pressure on the negotiations and moving that back. So we'll have to see how the statutes interplay between the medical requirements that now are imposed for 5579 that are imposed on the medical plans and how that will interplay with the dental plans. Hopefully those things are synced up. Senate Bill 5498 expands the ability for contraceptive coverage to be prescribed on an initial basis for up to 12 months as opposed to just refills, so creating a better access for contraceptive care. 5525 provides some additional protections and notices from employers to employees during mass layoffs. We included this because the state is considered one of the largest employers in this state. So there was interest of whether or not there'd be implications of that and the implications of certain protections for healthcare in that. The ultimate bill did not include the state as one of the covered entities, but school districts are included in that. So that's why we're keeping an eye on that just to follow that and see in the event that that does get implicated by any of the school closures or something to that effect, we would be able to help provide or have some additional resources to provide health insurances for any educators who would be laid off as a result of a school closure. We talked a little bit about 5579, and then last we'll hit 5807 concerning the wellness incentives for public and school employees' health benefit plans. This is legislation that does effectively close the Smart Health Wellness Program and the incentive as of 2028. I don't know, Dave, if you have anything else you want to add on that.
Just that, the part of why it seems like, check your watches, it's 2025 and that bill is 2028. It's a long on-ramp because of the collective bargaining implications. The incentive is currently collectively bargained. And so the legislature has signaled that, at the next collective bargaining process, there won't be an incentive because there is going to be no incentive. So there's a wind down. So, normally this is something I had highlighted that normally there are not fast moving parts to influencing the expenses of these large components of the state budget. And so there is often a longer on ramp for implications of changes. And this is a perfect example of that. The one other piece that I realized I should have said about 5083, that's the affordability reference-based pricing bill that I was referencing is the relationship to the provider network terminations. You might remember earlier this season that when we were describing 5083, the original iterations of that bill required participation by the impacted hospital systems or provider groups. And so that I think I even described it as like that would essentially eliminate for the Uniform Medical Plan, the entire network termination disputes that publicly happen. The final version of the bill does not require mandatory participation if a good faith contract is put out, but it does set a lower reimbursement rate for out-of-network services. So there is a financial incentive, a carrot instead of a stick, for a provider group or a hospital system that's impacted by that bill to accept a contract because they could get to a higher rate than they could by denying a contract, and they have a lower capped out of network service rate. So just wanted to describe that. The original iteration of the bill would have maybe eliminated again that entire network dispute process as it relates to UMP. The final version of the bill doesn't do it in that same mechanism. Instead, it just disincentivizes a provider group from denying a contract. So a little bit of a difference. So now 5579 has a little bit more implications for UMP and the portfolio because of how 5083 was changed. So just wanted to highlight in case people will remember it. Oh, that whole thing's not going to happen. The bill didn't end up exactly that way. It took a different policy angle.
And that's it. So I'm happy to take any questions. Last, in the appendix are the bills I had mentioned earlier in our board year that did not pass through, but again, they will be introduced by rule next year during the short session. So if just you have any references of like, what happened to that bill? Well, if it's in the appendix, it means it's coming back next year, and we'll see where it goes next year. We'll provide updates on that. So if there's no questions, I'm going to go skedaddle over to Spokane to go present at WASBO. And so I'll be over there presenting some of the similar things and talking with some of your colleagues over on that side of the mountains.
Drive safe, sir.
Thank you.
Traffic's a lot better on that side. Just saying. Cold coffee there because it was 73 yesterday.
Tanya.
All right. Thanks, Chair, members of the board. I am here to give our final budget update, hopefully, of this board season. We've been along this journey with multiple versions. This is the update on the final conference budget. One small caveat, while the budget came out on April 27th, that was a Saturday a couple weeks ago, the governor does still have until May 20th to sign the final budget. So we're going to walk through what's in the final conference budget. If anything changes in our budget, not anticipating it will, but if it does, we'll bring something back. But for now, we can consider this what's our final conference budget. This will all look very familiar. While this session was stressful and a lot going on, I would say this is an anomaly that our budgets were largely in sync from kind of the start as far as the House and Senate being in alignment. So these will look very familiar to my last update. So next slide is just the timeline. Again, as a reminder, session is done. Governor still has to sign the final conference budget, but what we talk about today, for the most part, will go into effect July 1st of this summer. So just to recap, in our supplemental budget, as a reminder, we have both a supplemental and a biennial budget that we consider during these longer sessions. So for the supplemental budget, I don't know who's moving slides.
Just catching.
One more, please. There we go. So for the supplemental budget, we had 2 decision package requests, and both of those were funded. So our third-party administrator spending authority. So this is our authority to spend the dollars we already have in the bank, basically, for our third-party administrators. Those are Regents and Moda and Delta Dental, who administer our self-insured medical and dental products. And then our contract increase decision package, this was funding to support some actuarial service increases we have had over the last few years, and that was funded in full also in the supplemental budget. So those we can start spending now through June 30th. And then what we're going to transition to talk through will all start with the new biennium. So for the biennial budget, next slide. Those first 2 items are the same concept as what we talked about for the supplemental budget, just the biennial version. So this is 24 months of spending versus just the catch up through the end of the biennium. So our third party's administrator spending authority at $7.8 million was fully funded, as well as our contract increases at $480,000. This next one is one of our biggest ones on the list here, and that's our IT resources. These are FTEs we requested to support and help stabilize our enrollment system, our benefits 24/7 system. While the agency requested quite a large amount of FTEs. In total, we were funded between the PEB and the SEB programs for half of what we requested. So while there's 3.5 attributed to the SEB program, there's a total of 9 that got funded for the agency to support the benefits 24/7 work. And those are split between the PEB and the SEB programs. It's always a little bit more weighted heavily on the PEB program when things impact retirees as well. Since our retirees are housed in the PEB program, we attribute more of that spending to the PEB program. So all in all, 9 FTEs, of which some are already in the works for moving forward on those recruitments, and the rest we will start immediately recruiting for with the new biennium. On the next slide, our doula funding remained in the final conference budget, and this is funding just to add coverage for doulas in the uniform medical plan. While doulas are not currently a reimbursable provider type, this would allow the funding, if we can operationalize this benefit, to start in the new plan year. I do want to caveat, we are still working on the ability to operationalize this with Regents. And so the funding is here if we can pull that off. And if not, we would still try to work towards operationalizing that for a future year. The funds are available for us to spend within this biennium. And then lastly, as Cade and Dave mentioned, Senate Bill 5083, this is our hospital affordability bill. We did have 1 FTE and some administrative dollars we requested in the budget. This is split between the PEB and the SEB programs equally, so the funding is there to support some of that actuarial work and the finance work that will have to happen to reconcile this bill once it goes live. On the next slide are just a couple additional budget items that were included in the budget. We've talked about both of these. The first one is just the technical consolidation of combining the PEB and SEB programs in the budget for accounting purposes. This is not a full consolidation. This is just one step at making things on the accounting and budgeting side a little easier. Right now, we have two separate programs in our systems. This would be one. All accounting will still be separate for the PEB and SEB programs as far as keeping money separate in their individual accounts. It'll just be all linked in one kind of column under one program instead of two. And then the next one is enhancing our employer paid long-term disability benefit. I believe Kimberly's on the agenda later today to talk more about this. But the legislature did give the authority to the board to enhance the long-term disability benefit from $400 to $450 within the existing premium that is within our base budget. So maintaining that same premium contribution and enhancing that benefit on both the PEB and the SEB programs. On the next slide, some of the items that were included in the final conference budget that helped address the budget deficit. We've talked a bit about the long-term disability reserves that we're withdrawing. On our employer paid side, we have reserves that are above and beyond what are required to keep in those reserves. And that comes kind of in parallel with the ability to increase the benefit because that employee or employer paid premium has been able to go a little further. And because of that, we've built up some reserves that we can withdraw. So for the
When you say withdraw, does that go back to the general?
Yes, we're gonna pull it out and we're gonna directly deposit it into the general fund. And that's why for people who have been really digging into the budget and looking, there is some transfer language in the back of the budget that has been there that will allow us kind of the technical ability to transfer from our account to the general fund. Right now, our funds don't have the ability to do that. That's why that's there. It's for us to withdraw the funds and put it directly in the general fund. Yeah.
Then it could be spent on
Yes.
some other
Yes, they've-
expense than the legislature.
Yes, the legislature, if you are looking through some of the conference budget documents, you would see this in actually a whole different section of the budget. It's not in our section because it's not coming directly from us to them. But yeah, it's a line item, one for PEB, one for SEB on some of the new revenue items that are coming to help address the deficit. The next one up is the closure of the UMP Plus plans at the end of the current plan year. This has been included all along from the governor, the House, and the Senate versions of the budget and remained in the final conference budget. As we get further into the board season, I believe we'll have additional conversations about the wind down of the Plus plans and what that looks like. The next one is the administrative budget reduction. We've talked a bit about the various accounts and the various budget reductions. I included in the appendix just for reference the kind of flow chart of our administrative budgets. And this was the 6% administrative budget that was tied to that very bottom right box for our agency admin. It's not cutting the big claims bucket or our TPA budgets. It's just the agency administrative budget, which, you know, pays for our staffing, the building leases, some printing, travel, things like that. And then the next one on the list was reducing our premium stabilization reserves. So within the PEB and SEB programs, we keep various types of reserves. This one is limited to what we call our PSR, premium stabilization. Currently, we keep 7% of annual self-insured dental claims in reserves to pay for self-insured claims if there was something short-term that needed to stabilize premiums. We keep 4% for dental. This would be reducing on the medical side, keeping 7% of annual claims to only keeping 5% of annual claims and freeing up those dollars one time to put downward pressure on our funding rate. So we'd be freeing up those reserves to buy down the funding rate for this first year.
Tanya, just remind the board when it comes to closing UMP Plus, you don't take an affirmative vote to close the plan. We just won't tee up rates for you to approve. And so it de facto will exist at the end of the year. So just a reminder about how that all works.
On the next slide is really one of the only pieces that was slightly different from my last presentation, but kind of not really. On my last presentation, the House and the Senate both proposed the elimination of Smart Health, but they did it in two different ways, ultimately getting to the same large end result. But the one that was in the final conference budget was based on the passage of Senate Bill 5807 that Cade described, which would eliminate the Smart Health Program as of January 2028, meaning employees would still receive their last incentive payment in January of 2028, but then no longer be able to access the portal and not receive any incentives beyond that date.
So effectively, there are going to be some things that we'll talk through about closing the wellness plan. But we won't need to have those conversations this board season. We probably won't need to have them next board season. It's very status quo. The portal will still be the same. The eligibility rules will be the same. The incentive will be the same. Everything looks the same until we get to the end of 2027 or transitioning into 2028. So for the next year or so, very little to mention or talk about with this even.
And the last slide is the final conference funding rates that will go into effect for the next biennium. So for school year 2025-26, it's set at $1,307, and the following school year at $1,341. A reminder, these are per employee per month, regardless of employees' enrollments. They include everything we just talked about. So the funding for the decision packages, any collective bargaining changes, which include something Kelsey's going to talk about here a little later, which is a new benefit that was included in this collective bargaining agreement. It includes our agency request legislation, so the downward pressure on those provider reimbursement caps, which ultimately get passed through the funding rate into employee premiums, and then as well as the budget reduction proposals that we talked about. Like Dave likes to mention, there's no magic number here. The legislature really has the ability to set these at whatever risk level they want. However, I'm very happy with what they did with these funding rates, and using the modeling that we provided and the actual items listed here below. We're very comfortable with the levels of these funding rates. Likely that second number will change here next session. It's the thing that once we get closer to the actual school year, the legislature, as they have more claims experience, enrollment information, understanding our rates that we procure here this year, they'll update that second year usually. And that's all I got for you. In the appendix is that little flow chart if you need it. Otherwise, I think we're maybe done with budget discussions this board season.
Unless there's some unusual governor action.
Let's not put
veto
that in the
something.
universe yet.
I'm just saying. I'm just saying. Yeah.
On that point,
Yeah.
I'll just point out that most of the policy aspects of the program and most of the things that Tanya described are embodied within the funding rate. Most of them are not express words on the page, like the reduction of the PSR isn't there to even be vetoed. For the most part, the language on a lot of these isn't is enshrined within the funding rate number itself. And so there are fairly low odds of something changing from what Tanya described. For example, the IT decision package, there is no language in the budget on that. It's in the funding rate number, and it's in the modeling behind the scenes. So there isn't even language to change that. So that's why we're so proactively working on position descriptions, and we won't begin postings until the budget is signed, but we have reasonable reasons to believe that those absolutely will happen, because there isn't a way for the pen to strike those, so to speak.
Any other questions for Tanya? All right, Tanya, thank you so much. Thanks for all the work.
Yeah.
Long session.
Long session.
Yep.
Right into rates though. So
There we go.
you'll see me for the rest of the season.
Next presentation is going to be on long-term disability. Kimberly, our senior account manager in ERB, is going to be providing an update on some changes to SEB program's long-term disability benefit and an introduction of a resolution for board action in June. Materials behind tab number 5. Green means go.
Good morning. I'm Kimberly Gazard, and I'm here today to talk about an opportunity we have with the SEB employer paid LTD benefit. So the SEB program has the opportunity to increase the employer paid LTD benefit amount to $450 without increasing the employer paid LTD rate, while still maintaining the employer paid the required 1 year's worth of premiums and the reserves for any LTD claims. The 2025-2027 operating budget includes the authority for increasing the SEB program employer paid LTD benefit from 400 to 450. The employee paid LTD rates will decrease by about 2% as a result of increasing the employer paid LTD benefit. And that's due to how the employer paid benefit and the employee paid LTD benefit work together. So as the employer covers more of the members' insured earnings, the employee will pay less. So next slide. This is the SEB resolution from 2021, which outlines the current employer paid LTD benefit details. The red line version of this slide with the proposed changes we are making is on slide 5 of my presentation. Next one. So we are proposing to amend SEB Resolution 2021 with changes beginning at the end of line 2. So we would be striking 2020 and inserting 2026. On line 14, after the maximum monthly benefit, we would be striking 400 and inserting 450. And on line 14, after 60% of, we would be striking the $667 and inserting 750. And my next slide will show how the resolution would read. So you have the SEB program will offer the employee paid LTD plan to subscribers beginning January 1st of 2026. The benefit waiting period will remain the same. So you have the 5 benefit waiting periods, and it will be the longer of which one applies to the member. No changes there. No changes to the no choice sick leave, and no changes to the choice pension. And then you'll see on the last bullet, the maximum monthly benefit will change from 400 to 450. And that is actually the 60% of, instead of 667, it would be $750 of the member's insured earnings.
Real quick before we move on, I know this is something that can be confusing for folks. Sometimes we bring resolutions to the board that are benefit design, and then that benefit design inherently spits out rates. Other times we bring to the board rates that are the embodiment of benefit design. And why we bring them which way we do sometimes is just the complexity of the benefit or just kind of tradition as to how we've described benefits. For LTD, we have historically brought the benefit design rather than bringing you rate tables. I can't really explain why. It's just what we've done, and we kind of mirrored that. I wish to acknowledge that sometimes it's one way, sometimes it's the other. It's effectively getting to the same end result. But this time, you know, we're bringing you the modification to the underlying benefit design that you've done before. So just wanted to acknowledge that because it might be a quirk that people ask about.
Thanks, Dave. Next slide. So this slide reflects the 2% decrease in employee paid LTD rates, which if approved by the board would be effective January 1st, 2026. Next slide. So we provided 2 monthly employee paid premium examples. The first example is with the 60% coverage plan, and the second example is with the 50% coverage plan. So for the 60% example, Mary is a 47-year-old school employee making $4,000 in monthly earnings and elected additional coverage with the 60% coverage level. So with the 2025 premium, the current premium, Mary's premium would be $14. And then in 2026, with the decreased premiums, the monthly premium would then be $13.60. With the second example, excuse me, Bob is a 58-year-old school employee making $5,000 in monthly earnings and elected additional coverage with the 50% level. So in 2025, Bob's monthly premium would be $17.50. And then with the 2026 new premium would be $17. So next steps for increasing the employer paid LTD benefit would be submitting and receiving any LTD policy resolutions feedback by May 19th. We would then bring the recommended proposed LTD policy resolutions to the board for action at the June 5th meeting. And then the SEB employer paid LTD benefit at the $450 benefit amount would become effective January 1st, 2026.
Any questions for Kimberly?
How does this impact people that are already receiving a long-term disability, like they're already on claim?
I can get back to you and find out how that. I believe, they don't pay any, I'll double check, but they, typically don't pay any premiums when they're on an LTD claim, so it would just be whoever is paying for the coverage that hasn't been, who's not currently on LTD.
Would they receive the increased benefit though? Like if they were receiving $400 a month, would they start receiving 450 or are they still?
Laura, you're asking for people who only have the employer sponsored coverage? Okay, because in the, for people who have a buy up into 50% or 60%, whether it's 400 and Kimberly will bring that as a great question for follow-up for people who are currently on claim and only have employer sponsored coverage.
Other questions? It would stand to reason they would receive the higher amount. But you're going to verify.
Things are not always logical.
Okay.
See the beginning of my comments where we're making adjustments on the spousal surcharge.
Yeah.
Great question.
Understood. Yep. We've got to check into it.
I can say when it comes to like the paid family medical leave benefit that the state offers, it's based on the time your benefit claim begins. So there's increases annually, but if you started your claim in December, you don't get the advantage of the increase that happens in January. So we'll get back to you on what the answer is.
Other questions for Kimberly? Kimberly, thank you so much. Good to see you. All right, why don't we take a 10-minute break? It's, what is it, 5 till? Let's go a little after 5 after. It was just brought to my attention that our microphone situation in the room is a little different. We used to have ceiling mics that picked up. If you forgot to turn on your mic, it would pick it up anyway and just take care of it. Well, that's not the case anymore. So if we're going to talk, and I've talked a few times without turning on my mic, thinking it was one way, it's another way. We do have to turn our mics on. So just a heads up. All right. We ready to go?
Yes, we are. And for the record, Pam joined during the break.
Awesome. Welcome. Welcome, Pam. Okay, Ryan, our UMP team manager in ERB is going to be introducing a resolution today regarding a change to breast exam coverage. This is the one we are going to be voting on, this resolution. Dave, would you like to provide any additional context on that? I think we did cover it, but if you want to talk about it some more, please do.
Just in this instance, as Ryan describes what the policy statement is, it's something that was identified based on some regulatory reinterpretation since the board last acted on this subject last board season. And the real reason that we were asking the board to take this action that Ryan's going to describe now is we've actually asked regents in anticipation of the board acting on this to hold claims that are impacted by this very policy and not adjudicate those claims until the board acts. And so if the board is comfortable acting, then those claims can be released and properly adjudicated instead of having them adjudicated one way and then re-adjudicated after the board acts. So we said, for now, regents, please pause on these, but we'd like to get the claims flowing properly and only adjudicated once. And so hoping that the board will act today. But Ryan will describe exactly what the process is after Lou reminds people how we vote.
And the way we vote is we're going to ask for a motion to adopt. Second, we're going to invite public comment. We're going to ask for discussion for the board. So if there is any public comment, the board will hear that before their discussion. And then we're going to initiate the vote. The materials are behind tab number 6. Ryan? The floor is yours.
Chair McNervant, members of the board, my name is Ryan Ramsdell. I'm the UMP TPA Count Team Manager. I'm going to speak to you today about the high deductible plan diagnostic and supplemental breast exams resolution that was adopted last year. Next slide, please. So as Dave said, what this relates to is at the time at which this resolution was agreed to by the board in 2024 to be effective January 1st, 2025. This particular benefit did not have support or guidance had not been provided on behalf of the IRS pertaining to the first dollar requirements under the health savings accounts and high deductible plans. As you're all aware, unless the IRS takes action, certain benefits are not able to bypass the medical deductible component of the benefits for high deductible plans only. So in January 1st, 2025, the board did agree to acknowledge that they wanted to support the benefit, which was covering supplemental and diagnostic breast exams without a cost share, with the exception of the high deductible plans, which must meet their medical deductible requirements before the zero savings continued. Next slide, please. This pertains to a resolution that was tied to a bill in 2023 that affected the fully insured health plans. The board elected to have UMP align with that requirement, which was to have first dollar, essentially treating it like a preventive service of sorts and not have it require the medical deductible component of the benefit, with the exception again of CDHP and high deductible plans. So we did align with that, but we'd like to make an update to the resolution. Late 2024, the IRS provided additional guidance indicating that this particular benefit could meet those same obligations as several of the other benefits that the CDHP and the high deductible plans can bypass and begin to cover first dollar. So there is a single sentence in the former resolution that we would like to update, and this would be an increase in benefit, or it'd be beneficial to the members to receive this resolution change. So next slide, please. The original resolution 2024-08 for SEB as adopted was beginning January 1st, 2025, diagnostic and supplemental breast exams to be covered without member cost share to Uniform Medical Plan UMP members. UMP high deductible members need to meet their deductible before the plan will pay any portion of the claim. Next slide. The proposal strikes the final sentence in that resolution. So we are proposing a resolution SEB 2025-02 that reads, beginning January 1st, 2025, diagnostic and supplemental breast exams are to be covered without member cost share to Uniform Medical Plan UMP members.
And then slide 6 is just, so normally we bring you what is slide 5. Next month, we would bring you the final one for action, but it's right here before you today. Again, the reason we're asking is because we're leaving the effective date of your original resolution intact and instead just making this retroactively apply to UMP high deductible. This is not something that needs to go through like a decision package process or additional funding authority, because if you think about the structure of these programs, the cost to the state is rooted in what happens to UMP Achieve 2 and UMP Classic in the PEB program. So this adjustment in UMP high deductible or the high deductible plans doesn't have any impact to the state. If there were a bill that did this or something and we produced a fiscal note, it would be a $0 fiscal note because it's impacting a plan that isn't part of the benchmarking process. So that's why we're able to bring something to you. And while we're in the middle of the same plan year, we can do it retroactive and have regents re-adjudicate any claims that they before we ask them to hold, and then they can process all the claims that they're holding right now under this new rule and have first dollar coverage apply to these areas. So, you know, again, it's an unusual circumstance to bring you something and ask you to act on it immediately. This is a benefit enhancement that is falls outside of the place of needing additional funding authority. It's a strange one that allows us to be able to be done retroactively. It just checks a little bit of like strange, quirky boxes, but it is something that benefits members, doesn't represent a cost to the state, is the spirit of the entire conversation that has been happening with diagnostic and supplemental breast exams in the fully insured market in 2023 and UMP come 2025. And then this is the last vestige that had to be carved out because the IRS had not yet issued guidance. They've now issued guidance, and we're saying, please act in the member's interest and allow this to be part of the first dollar coverage of UMP high deductible. We'll be taking a similar resolution to the PEP board next week for their high deductible plans too. With that, if there's not questions, Chair McDermott.
All right. No questions for Ryan? Okay. We're going to take a vote on Resolution SEB 2025-02, amending Resolution SEB 2024-08, UMP diagnostic and supplemental breast exam coverage. Resolved that beginning January 1st, 2025, diagnostic and supplemental breast coverage are to be covered without member cost share to uniform medical plan members. Is there a motion to adopt?
Donna Hanson, I so move.
Is there a second? All right, any comments?
Laura Johnson, I second.
Here we go.
Went red.
Well, red's not good. We're looking for green. All right, do we have anybody out in Zoom land or in the room who would like to make a public comment? Nope. Seeing none. Any comments from the board? All right, roll call vote, starting with Donna.
I say yes.
Myra.
Aye.
Allison.
Yes.
Laura.
Yes.
Carrie.
Yes.
Pamela.
Aye.
Omid.
Yes.
Terry.
Yes.
And Lou. Yes. Resolution 2025-02 passes. Brian, thank you so much.
And thank you, board. Again, I don't like to bring things to ask you act on them immediately. I think it's happened less than 5 times in the last 7 years between both boards. But it's unusual circumstances like this, and I just appreciate your support and acting so quickly.
Next up, Kelsey, a senior account manager in ERB, is going to give us an update on flexible spending arrangement benefit changes from the last SEB program collective bargaining agreement. Her materials are behind tab number 7. Kelsey, welcome. It's still morning. Yeah. Good morning.
I am now being recorded. Okay, we're good.
Start again.
Okay. Good morning, Chair McDermott and members of the board. My name is Kelsey Pele, and I am the Senior Account Manager for the Flexible Spending Arrangement and Dependent Care Assistance Programs for our PEB and SEB programs. And I'm here to talk more about the SEB program collective bargaining FSA. I was here in January at the retreat we had in January, and I'm back to provide more details on communication and operational plans that will go into implementing this benefit for our SEB employees come January 2026. All right, next slide. Okay, so just a quick recap for you all and get us familiar again with tax advantage benefits. The flexible spending arrangement is a tax savings benefit offered to SEB employees that allow FSA funds to be deducted from the employees' paychecks before taxes to reduce their taxable income. Some eligible expenses, examples of those are that they can use their FSA dollars on are their annual deductible, co-pays, co-insurance, prescription drugs, first aid supplies, sunscreen if it's over SPF 15, vision hardware, and more.
Is that a fact?
Yes, he makes me say it.
The IRS makes me say it, so I make her say it.
Because if it's not sunscreen, it's just lotion then, right? If it doesn't have any SPF,
Yeah.
Understood. Okay.
Tanning oil does not count.
Yeah, no. For the plan year 2025, employees can elect a maximum of $3,200 in their FSA funds or a minimum of $120. The election amount is subject to annual Internal Revenue Service, IRS, cost of living adjustments
and funds contributed by an employer do not count towards the maximum allowed election amount. All right, next slide. Okay, so now let's talk through the stakeholders involved and what the SEB CBA FSA employer contribution is. This benefit was negotiated for certain employees to receive a $200 FSA employer contribution that begins in January 2026. And included in the appendix are specific eligibility criteria the SEB employees need to have in order to receive the $200 CBA FSA. But just a quick synopsis of eligibility requirements is that they must earn $40,000 or less for the fiscal year prior. They have to meet SEB program eligibility requirements on January 1st of the plan year. They can't waive their medical coverage except to be dependent on another SEB non-high deductible health plan, and they can't be enrolled in a UMP high deductible plan. This benefit is not under the board's authority. Instead, it's under HCA's authority. HCA designs this benefit to ensure it complies with the collective bargaining agreement and contracts with Navia Benefit Solutions to administer the employer contribution. Navia Benefit Solutions, our FSA vendor, creates and manages member accounts. And the SEB organizations play a key role in communicating this benefit to their employees as well.
Kelsey, just a couple of other things just to remind folks. People who receive this benefit receive it if they meet the eligibility requirements, regardless of whether they independently elect and open an FSA. So if somebody doesn't make their own contributions from their paychecks and an election for those deductions, the agency through Navia will open an FSA account on their behalf and put $200 in it and be communicating about that. So what I just wanted to be very clear that the eligibility requirements do not need an independent election. Another question that I think some people ask is, you don't need to take the slide back, but the end of the prior slide said, employer contributions don't count towards the maximum. There are rules though that limit how much an employer can put in. So just wanted to lay that out there. That's an important piece, that the sky is not the limit on a total employer contribution. There are maximums, even though they don't count towards the employee election. There are limitations on how much an employer can put into an FSA. And so just wanted to highlight that too.
Thank you, Dave. All right, you can move on to the next slide. Okay, so to prepare for implementation of this benefit, we have created a communications and operational work plan that includes milestones and review periods and tasks that happen throughout the year and into Q1 of next year. So the purpose of these work plans are really to define the goals we hope to achieve during implementation of the benefit, identify the strategies we'll use to achieve our goals, really know who our audience is or who our audience are and how we need to communicate with them, identify the key messages and talking points, describe the tactics we'll use to communicate, and tactics I'll describe in communications work plan and later slides, and set expectations both internally and externally with Navia and Department of Retirement Systems, and then understand the data set used and execute custom data exchange processes between Department of Retirement Systems, HCA, and Navia. Anything more on that one?
Just I think we live and breathe this a lot more every day. A reminder of why Department of Retirement Systems is part of this equation. I think this is going to be one of the parts that might be most challenging for people, especially the school employees who receive this or don't receive it, grapple with. The eligibility requirement on the salary or the salary cap is really rooted in the prior fiscal year. So school employees generally are thinking of things at a school year basis, and we're talking about a calendar year benefit that's based on a salary of a prior fiscal year from the state's perspective, not the school fiscal year, which goes from typically October to September for folks. So the way to think about this is the first benefit in January of 2026 will be based on the salary and information that the Department of Retirement has received for purposes of pension calculations that ended June 30th of 2025.
Right.
Yes.
And reported
2025.
by the employer to DRS.
And yes, and reported to the employer by DRS. So it's really salary from July 1 of 24 through June 30th of 25 that is used for a benefit that's issued in January of 26. And so we will have definitely school employees who go, how does my pay that I receive in the summer of the prior two prior school years impact my benefit now? We know that that's going to be a challenge to work through with people, but the fundamental benchmark is there is a data set at DRS that has a snapshot in time, and we look at that snapshot and use that for determining eligibility. Whether there are changes to salary that occur between that snapshot and the benefit being delivered, that is not accounted for. This benefit is designed with a specific snapshot in time. Now, if an employee is able to have identify an error in what was reported to DRS, then that's something that needs to be rectified for purposes of their pension calculations as well. And so getting the data cleaned up with DRS would then flow over to the healthcare authority, and we could make adjustments as necessary. But it's going to be needing to address the underlying data set, not proving to the healthcare authority that there was a different salary in place, if that makes a little bit of sense. Donna?
Thinking about substitutes who are eligible for SEB, who could hit that threshold. Is that an issue? Like if you have a paraeducator who's a sub or a teacher who is subbed enough to get benefits, but they're not in DRS for retirement purposes.
I think
Their earnings are still reported to DRS.
Yeah, all of their earnings are still reported to DRS. So it's, all of their earnings are, thank you for reminding me about that. All of the, for substitute.
Okay.
All of that data, that's one of the reasons that was motivating to use the DRS data set is it's a fairly complete data set. It also has, DRS does a lot of audit cleanups because they need to have it ultimately scrubbed for pension purposes. And it's something that the districts are already providing to the state. So it was leveraging an existing process rather than creating another salary process for districts to report to some part of the state. So all of those things were reasons that set was selected as hopefully ideal. We know that there are going to be some interesting parts of this, but if the person meets the salary threshold in that snapshot, and then is benefits eligible and enrolled in any of the qualifying medical plans or not enrolled in any of the excluded plans in January, they receive it.
Right.
Got it. Thank you.
Starts with salary and then
Yep.
program requirements come later. Okay, next slide, unless there's any other questions. Okay. So when developing our SEB CBA FSA communication materials for different platforms, we can use already existing PEB CBA FSA benefit communication materials as kind of a starting point and tailor them to SEB as needed. We will also encourage benefit administrators, our BAs, and our labor unions to use a toolkit in order to share consistent and accurate messaging and promote the benefit to eligible employees. And I went into this in more depth in January, but a toolkit is kind of a compilation of different types of communications available for for BAs and labor unions to use to communicate to their employees. So as like a new hire letter, a CBA FSA video, 2 to 5 minute video that they can, link to their social media. We have shareable messaging that they can provide, FAQs, an eligibility flow chart, and much, much more. We will also collect feedback from BAs and Navia about any trends they see to evaluate efficacy of the communication tactics. And then later in 2026, we will survey SEB program employees and BAs to assess the effectiveness of our communications as well. Okay, next slide. Okay, so these next 2 slides will go more in depth about what communications are taking place each month from January 2025 to, I think, July of 2026. So this past January, we previewed the SEB CBA FSA benefit to SEB benefit administrators, labor unions, and then also, of course, at the January SEB board retreat meeting. In March, we finalized our communication work plan. In August, the outreach and training unit will present benefit offerings at it's preparing for the start of the school year webinar I think on here I put it's a open enrollment webinar, but I was corrected about it's a preparing for the start of this new school year webinar. So I wanted to call that out. And the SEB CBA FSA benefit will be included in that. And then let's see, we will post the SEB program CBA FSA toolkit materials on the benefit administrator webpage, the SEB BA webpage, and email the link to the BAs and unions so they can have that available to them. And then I think this third bullet here states introduce CBA FSA benefit to employees in the SEB program newsletter. That actually happens in October. It's not August, so that's an error on my part there. We'll make that adjustment, but that mailing of the newsletter to SEB employees goes out on October 13th and not in the August timeframe that I have it here. So just another clarification I wanted to point out. And then lastly, in August, for real, we will add SEB program. We'll add the FSA information on the HCA website as well. And then in September here, we will update Navia materials and their website and include the SEB CBA FSA information on the Navia side as well. Next slide. All right, so this is just a continuation of the communication plan. In October and November, we will include SEB program CBA FSA benefit in open enrollment messaging for BAs and employees. And then, like I stated before, we'll have that October newsletter be mailed out on October 13th with information about this benefit as well. And then in January 2026, HCA will send an email notification to BAs about the customized CBA welcome letter and debit cards going to the SEB program CBA FSA recipients. And then Navia will send the welcome letter, which is basically the eligibility letter. You're getting this benefit. Here's why. This is what to look out for. And then also send a debit card in the mailing to the eligible recipients as well. And then in July of 2026, HCA will mail a mid-year reminder letter to those who have not yet used their funds to say you have it, please use it. It's for your benefit. So that is communication plan. Okay, so let's switch gears now, and I'll take you through the next two slides that depict kind of more operational work that goes behind making this benefit happen. So this past March, we finalized our ops work plan, and then in April, HCA met with Navia to strategize on timing efficiencies, operational tasks that would happen on the Navia side, risk management. And then next month, I will provide eligibility and communication training to our outreach and training unit employees and supervisors. In July, HCA will host a kickoff meeting with Department of Retirement Systems to discuss the data exchanges that go on later in the year. And then in September, HCA account management, myself, and our Pay One teams will begin meeting weekly on FSA and DCAP custom file exchanges. And then in December, DRS will send that school employee data to us as an HCA. And then next slide. All right, so in January 2026, after OE data has processed into our Pay One system, HCA applies SEB program and salary threshold data. I like to call it a data scrub. So we apply that $40,000 salary limit and scrub out those who have waived coverage, medical coverage, and are on a high deductible health plan. HCA and Navia will audit that list that it comes down to. Then HCA will send that final list to Navia. And then Navia will then send custom CBA welcome letters to the recipients. Navia loads recipient accounts with the $200 CBA FSA funds. And then lastly, they'll send out the debit card to the eligible recipients as well. So as you can see, a lot of the work and the bulk of the operations behind this is in January. We do a lot of communication efforts before it to get ready, and then boom, January is a very busy month for us and Navia. And then in February through April, we will just monitor inquiries, excuse me. O&T will receive, I'm sure, inquiries about this from benefit administrators, and Navia customer service will also answer inquiries from employees that call in as well. All right, next slide.
And Kelsey, what I'll just say is one thing that I really hope and that we'll be pushing to occur in January is asking benefits administrators and the labor unions to push out at least a component of the communication toolkit that's made, which is like a snapshot, a screenshot of the debit card and saying, you may be getting a debit card in your mail. As we started this benefit a couple of years ago in PEB under that collective bargaining agreement, there were a number of people who just weren't expecting a credit card from the state and we're like, this can't be real, it's a scam. And I think we all get a lot of good to go text or seeming good to go, pay your toll text and things like that. And it just seems too good to be true. So I must just throw this away. And so we really have worked on the design of the card. It's changed a lot in the past couple of years to help with maybe making it feel more legitimate, because it is legitimate. But the more that benefits administrators and labor unions can go and say, hey, there is this card, it's going to come from this entity, and this is what it looks like. This is real, folks. I think that's a key part as we launch this benefit. And while HCA is doing all of the scrubbing and the data files and working with Navia, I think the biggest thing that our partners can do is help make sure people realize that if they get this card, it's a real thing. So that's a key part of this launch. And good news, if they throw it away because they think it's a scam and then they later realize that it's a real thing, they can get a debit card replaced for free.
Yep.
So that's built into our process.
Yep. All right. And then lastly, I want to remind everyone of the FSA plan design, which is carryover. Carryover allows.
Real quick, I think there's a question from Laura.
Oh, I'm sorry, Laura.
Is there a reason DRS can't send the file any earlier and it has to be in December?
So we have been talking with DRS about exactly when they can send it, whether they send it in August or November or December. We still have to wait for all of the open enrollment to happen for us to apply it. And so I think our general thinking while we're starting to bring this up is they're doing as much scrubbing of their files as possible. And the longer they have into the fall for their natural audit scrubbing process, the cleaner that data file will be when it comes to us. So I think we're targeting somewhere in November or December, but we're saying December for now until we get truly through the startup of the data file exchanges. So it might be a little earlier than December, but I think like I said, there's this idea that allowing their natural audit process to happen at the beginning of the next fiscal year for the state perspective can only strengthen that file.
Yeah, I just think as benefit administrators, they're going to be asking from day one, like, who are eligible employees, and waiting until January. And once the benefit's already effective, they're going to want to know, these are your list of people that received this. And so the earlier that can be sent, because I just know they're going to be, who are people? And we'll get that question too from employees of, am I eligible for this benefit? And without, being able to say with any sort of certainty, yes, you're on the list, or.
And we definitely won't be able to say for certain until after we're able to do the scrub of, are they in benefits and not in a high deductible health plan and not waived until January. So we can explore with the benefits administrator group if there's some window between when we get the DRS file and
something like you meet the
preliminary.
salary requirement, but you have to enroll in benefits and not the high deductible or something. As long as, during open enrollment, like shortly after open enrollment, like, yes, you enrolled in benefits and you met the salary threshold.
Well, like I said, we're still kind of in the early stages with DRS exactly when that file exchange will happen. So there's still the potential for movement. And so we can talk about that and take that under advisement.
Okay. All right. And then, yes, just wanted to give everyone a kind of a recap of what carryover is. So it's the FSA plan design. Carryover allows unspent FSA funds to carry over up to $660 to be carried over for the next plan year, for use in the next plan year. So for participants to carry over unspent funds, participants must enroll in an FSA for the following year or have at least $120 left in their FSA balance. And then if a CBA FSA participant has at least 120 left in their account, the funds will be available for use in the next plan year. even if the participant doesn't actively enroll in an FSA. So if an CBA FSA recipient uses 100 of the $200 and they don't use the rest of it by December 31st, or they don't submit claims for reimbursement by March 31st of the following year to Navia, they will forfeit those funds to the HCA, which kind of leads to my next bullet that's very important, and that is that HCA, the SEB organizations, labor unions, and Navia will just need to continue to educate members about the CBA benefit design and carryover for use in future years. And that is all I had for today. I really appreciate being here again. And speaking about this benefit, is there any questions? Yes, ma'am.
Sorry, one more question. Will employers have a W-2 reporting requirement?
I believe so. No, no,
No.
yeah.
So for like the HSA,
It's not
like
in the
you will
state.
report employee contributions, but we also have to manually add in the benefit contributions into their HSA as like,
I don't believe with the FSA that there's a similar W-2 type reporting requirement for the employer piece.
But we're gonna double check on that.
Yeah.
Yeah.
Yeah. Well, that would I feel more confident about than the LTD question
Yeah.
earlier, though.
I heard I don't believe and I don't think so. And so
Yes.
we are gonna check on that and
Yeah.
we'll get back to the board on that one.
Yeah.
Other questions for Kelsey? Seeing none, Kelsey, thank you so much.
Thank you.
Appreciate it.
And on that point, Jimmy, I usually don't lean into, I don't think, but FSAs are kind of my pet. They're my pet insurance. They're my pet project. And I really just for some reason geek out on them. And so just sitting here thinking about all the various tax implications, like that one, I feel I don't know that I could describe it really easily in words right now, the difference between HSAs and FSAs for that purpose, but we will confirm. It seems really unlikely and know that there wouldn't be the additional piece.
just a question you might get from benefit administrators as
Yep.
you're communicating it.
Yeah, perfect. Either way, a proactive question to answer. That's great.
Yep, appreciate that. All right, next up, Brett, our CIO from our Enterprise Technology Services Division, and Jean Bowie, the Deputy Director of ERB, are going to bring back the latest happenings with Benefits 24/7. Materials are behind tab number 8. Brett, Jean, welcome.
Glad to be here. Good morning, folks. So going to roll up to the first slide there. Update since our last meeting. So we're making great progress on our stabilization effort. As you'll see on there, and actually I've got some updates since we actually published this to you folks originally. So of the number, just to recap, we are working through several more sprints. Remember, sprint is like a 2-week effort, focused effort on development to stabilize our Benefits 24/7 platform. And we'll be wrapping that up here at the end of May. But the number of high priority tickets that we've been dealing with has come down since our last meeting of 82 down to 49. Actually, we're at 39 as of this morning. So we're making progress really well. And what I forgot to put on there is we had a goal of having them less than 35 just to maintain, what's stabilization mean? There's always going to be some things, there's always going to be stuff cropping up, but we wanted to set some thresholds. That's what the goal notations are for, is just to say anything below that we feel would be normal operations, normal things for us to expect that we'd be getting in at any given time. So we're at 39, so we're almost at our goal of 35 or less. As far as our sync record backlog, and just to remind you, the sync log is when we sync from Benefits 24/7 to Pay One, how many of those records are held due to issues, and that could be a whole variety of different things. Some of them very innocuous, but some of them are more material. But we've been making great progress on that, coming down from 4,700 down to, actually, as of this morning, 1,304. So we're definitely below our goal there and continuing to bring that down. Error files, so those files that have some kind of error in them that result in a sync issue, that actually, as of this morning, is 620. So making great progress. We're down below our original goal of less than 1,000. And then within pay one, the number of high priority tickets as of this morning was actually 165. So we are definitely on track to get to meeting or exceeding our numbers by the end of the month with this stabilization focus as planned.
Brett, question, now that we're sort of throwing the kitchen sink at it, so to speak, are we going to revise our goals now that we can see what the art of possible is?
Yeah. So we've talked about that, and the group, my team, my development team, has noted that, and Dave, you might be able to add some color to this, that while our numbers are down below what we originally thought, there will be some churn during transitions in the season, stuff later in the summer or into the fall that might have this will be a little bit cyclical. And so we'll hopefully continue to drive our numbers down. I know we will, but there'll be some activity. And I think, Dave, you have some thoughts on what that activity actually could look like.
Yeah, right now is kind of a lower point in eligibility and enrollment changes. But in the next 30, 60 days, that's when a lot of K-12 will begin sending their retirement information to this agency to enroll in PEB retiree benefits as of July 1st. So we see this year over year, we see this bubble of enrollment activity that happens in late spring, early summer related to retirement. And then in the SEB program in particular, from September through end of October, even early November, there's another bubble. I like to describe that there's like a 10 to 12% workforce turnover, new school employees in the SEB program that naturally happens year over year at the turn of the school year, because eligibility in this program reboots every September. And so there are those two cyclical components in K-12 that drive different numbers and volumes that happen in our system. So we've talked about, after we see kind of full cycles of a year, maybe adjusting some of these goals, but recognizing that we are in a valley of volume right now and we're about to go into a peak, and knowing what we think is a tolerable amount for our staffing levels, we're going to test those numbers as we hit those various cycles and see how we're maintaining with those staffing levels. And if we are achieving even better than what we have set right now, then after we've gone through some of those cyclical events within the SEB program, we might adjust what our expectations are of ourselves.
Right. That's great. So, but for right now, as we continue through stabilization, we're continuing on our moratorium of changes and new features and functionality. So just staying focused on getting the cleanup work done. As far as our staffing, we have started to develop position descriptions for the additional staff members, and primarily the last two bullets there, as we prepare to look at how we want to staff those. We've started to do the preparation for getting the position descriptions written and the class and comp work done, so that we're ready to post those sometime in the near future once the budget is finalized. So getting all of our preparation work done and out of the way. And hopefully we'll be able to fill those very quickly and move on with the speed of our development in other areas.
Dave, just a clarification, there were more than 6 FTEs, correct, that were approved in the budget?
Yes, Tanya described that there was a decision package related to benefits 24/7 that was primarily IT positions, but was not exclusively IT positions. The totality of what was approved was 9 FTEs, 6 in our enterprise technology services IT area, 2 in our financial services area in the accounting department, and 1 within the outreach and training unit within the division that I oversee. And so there are those 9 FTEs. They are alluding back and forth, you can't see them in the budget. They are part inherent in the underlying models of the funding rate numbers. And that's why so they are pending confirmation, meaning the signature of the budget. It would be very challenging, and I'm not even sure exactly how it would happen, if it's even possible to not have those FTEs approved in the budget at the end of the day, unless the entire budget were not signed by the governor. And so we are working through the beginning stages of recruitment, but we will not begin the outward manifestations of those efforts until after the budget is signed. But it was 9 FTEs. Don't get confused by Brett's describing the 6 that are in his area. Tanya described that only 3.5 of them are funded out of SEB money and the other 5.5. But in totality, there are 9, 6 ETS, 2 finance, and 1 outreach and training. And a partridge in a pear tree. And that partridge is covered by pet insurance.
We're a little squirrely this morning, sir. Yeah.
And I don't know if squirrels are covered as pets.
Yeah. Yes, as long as they're wearing SPF 15 or greater. Yes. All right, Brett, back to you, sir. Oh,
I'll turn it over.
Jean?
Yeah. Good morning, Chair McDermott and members of the board, Jean Bowie, ERB Deputy Director. And so as Brett was sharing some of the metrics around stabilization and where we are there, we have been receiving some pretty positive feedback. We meet regularly with PEB and SEB benefits administrator work groups and have been getting positive feedback on the status of the stabilization efforts so far. And part of the feedback we had received from, I believe it was one of the SEB work groups, had to do with reporting. And so we recently convened a work group of benefits administrators to provide some insights around the reports generated out of Benefits 24/7. And we're able to prioritize 4 top reports based on their feedback. And so the Brett's team is currently working on those priority reports, and we expect to have those available later this summer. We continue the weekly updates to the BAs on the status of bug fixes and the resolution of issues. And again, the feedback on that weekly communication has been very positive, so that folks have more visibility into open issues and are able to see what items are priority for us on within those weeks. And additionally, ticket volumes have decreased, and so issues are being resolved much more timely than they were. Next slide, please. So, to fully support the Benefits 24/7 and Pay One teams in stabilizing the platform to be ready for next open enrollment, the program committed to minimizing the new work that would be required of the teams. There are certain projects related to legislative actions, specifically this year with the closing of the UMP Plus plans that the team is currently preparing for. And then just general system work that is required every year for open enrollment. So although there are other refinements or improvements that we in the BAs would like to see in Benefits 24/7, planning and scheduling those is being delayed until next year. Last year, we implemented Part D in UMP in PEB and also the standalone vision in PEB. And both of those put a pretty huge strain on the new system and the resources supporting the system. So ramping it back a little bit this year.
And Jean, on that point, just as we think about the things that Tanya presented that were in the budget, the modifications to LTD have minimal impact on the IT systems themselves. The SEB FSA CBA benefit is really done mostly outside of the system. So it doesn't require, it really has minimal impact on Benefits 24/7 itself. There are similar IT resources on the Pay One team that interact and help implement that benefit, but it's about their workload, not changes to Pay One or Benefits 24/7. The primary change that has come out of the legislative process so far is the closure of UMP Plus, but it is easier technologically speaking to close a road than it is to build a road.
Fair enough.
Laura?
What about the spousal surcharge and the intuitivity of those that needed to make that attestation during open enrollment?
So language changes are also less IT intensive to be done. And when Jean highlighted that a lot of additional enhancements would be delayed into 2026, there are natural parts preparing for open enrollment that the work stream does have that exists for modifications that are related to open enrollment. And there are in particular, language things that can be updated alongside of that process to improve the usability of the system from the member perspective. But like we were alluding to earlier, question 4 needs revision and the spousal surcharge. Attestation form process, that'll be done on the paper form process in the future, and that is a language modification that can be adjusted in the system. It's important to know, and so Laura, we're going to speak in a little more in the weeds for you, because I think we actually record where people get knocked out in the knockout questions. We're not going to change the order of the questions, but we can change the wording of the questions.
I just mean those that have to reattest annually, and like it was a little bit buried this year, and a lot of people missed doing it completely, or they attempted to but didn't actually complete the process. Is there going to be any sort of enhancements to that process during open enrollment?
Jean, do you have any insights about that one at this point?
I don't. We can get back to you on that one, Laura.
I thought you were asking about
I
or
know that there's the word changes that need to occur, but I know in an earlier board meeting we had talked about there were some retroactive changes that were made because people logged in and attempted to make the attestation,
and they saw the radio button filled in, but then they didn't hit confirm, and therefore it didn't capture the change. That's all coming back to me now. So we will follow up we have monthly updates with the board on benefits 24/7. We can talk about where that is in the pipeline.
Okay. Next slide, please.
Any additional questions from the board? Seeing none. Brett, Jean, thank you. Appreciate your time. All right, next up is public comment. We're going to go ahead, and for those of you on Zoom, please raise your Zoom hand. We'll get a list. And remember, when we call your name, then we'll give you the ability to come off mute and camera to say your comments. If there's any comments from the public in the room, please raise your real hand. Seeing none, we will look to Zoom land. Okay, why don't we give a few more seconds? So again, public, if you're on the line and you would like to make a comment, now is your opportunity, as we're going to be going into executive session and then coming out of executive session, and I assume shutting it down.
Adjourning. We call that adjourning. Legally.
We'll be shutting the meeting down through the mechanism of adjourning. See any hands? All right, now I will read our magic statement. All right, here we go. We're going to be transitioning to executive session, which is going to happen here in the Sue Crystal Room for board members and included HCA employees. At this time, members of the public joining us in person at HCA will be, who are not part of the executive session, will be asked to wait in the main lobby for the duration of executive session. You'll be called back in to join us in the Sue Crystal for the remainder of the public meeting after the executive session is concluded, which will just be adjourning. Pursuant to RCW 42.30.110 subsection 1L, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state purchase healthcare services as provided in RCW 41.05.026. The executive session will be concluded no later than 1:15 p.m. Board members, let's go ahead and take a quick break as we transition into executive session. And if you're virtual, please use the separate link given to you via email for the executive session, and we will see you when we engage here. I think the link was sent to you. If you're looking for it on your email, it was sent to you on Tuesday around 10:45 a.m. All right, thank you.